All right, for those who are just joining us, again, I'm Karen Borgstrom. I'm the Director of External Affairs for Dartmouth-Hitchcock, and I'll be moderating today's panel. Thank you so much for joining us today for a discussion for folks who have concerns about the COVID-19 vaccines and have questions about the safety and efficacy of the vaccines. Before I introduce the panelists, I just want to remind everyone that we are recording the event so that colleagues of ours who cannot watch live today will be able to watch the recorded event at their convenience later on. We are closed captioning the event, and that is why it is being live streamed. We'll post the link on the intranet after the event so that you'll be able to find it and watch it or forward it on to friends and colleagues who work at Dartmouth-Hitchcock. And your participation in the event is confidential and your questions will be anonymous. So with that, we're excited to have 4 panelists who will share information, will listen to, and hopefully answer the questions and concerns that you have. With us today is Dr. Phil Adamo, Dr. Jose Mercado, Mike Harhen, and Marilyn Hill. Dr. Adamo is the Section Chief for Occupational and Environmental Medicine. Hi, Dr. Adamo. Also with us, Dr. Jose Mercado. Dr. Mercado is an associate hospital epidemiologist and is the COVID-19 response leader at Dartmouth-Hitchcock. Hello, Dr. Mercado.
Hello, everyone.
Mike Harhen is the administrative director for the lab. Hello, Mike.
Good afternoon.
And Marilyn Hill is the manager for the ambulatory pharmacy. Hi, Marilyn.
Hello.
So for those of you who have joined us, if you've tuned into this webinar, we know that it's important to you to be able to get answers to the questions you have that have been on your mind about the COVID vaccines. We'll hear very briefly from our panelists, and then we'll open it up for questions for about 20 minutes since we only have about a half hour for today's webinar. With that, let me turn it over to Dr. Adamo. Oh, you're muted.
Thank you, Karen. So for those of you who do not know me, I'm an occupational medicine physician as well as an internist. And I have been involved with public health, or for a better description, population health challenges for over 20 years. I can remember the involvement that I had with the H1N1 virus in the early part of the new millennium. I also have been chair of the Board of Health in Pittsfield for 10 years, where we had concerns about exposures, not only to viruses, but also chemical exposures. Employees are a population that I have focused on since 1995. I do have to say that this is not new. There were lots of controversies back in 1777 when the first mandated workplace vaccine for smallpox was mandated for the Army under George Washington. And I have to tell you that Benjamin Franklin was against smallpox until the smallpox vaccine, until his youngest child died from smallpox. And Washington was concerned that that the enemy would use smallpox as a biologic warfare, even back then. So I can't say enough about the science behind the vaccine, and hopefully you will get something out of this conversation and think more closely about the vaccine.
Thank you, Dr. Adamo. Appreciate that. Let's shift over now to Dr. Mercado. Would you like to share a brief statement about your thoughts about the vaccines?
Thank you, Karen. Yes, I wanted to reshare some of the data that the CDC had given us. You know, what we know so far is that, or for where we are in the pandemic, is the unvaccinated individuals are 5 times more likely to be infected and 29 times more likely to be hospitalized from COVID-19. We know that the Delta variant is about 50% more transmissible or more infectious when compared to the Alpha variant. And on top of that, you know, outside of the acute infection, there's a 10 to 30% chance of any infected individual developing long-term symptoms. And these are very concerning numbers. Yes, it is true that you can have immunity from natural infection, but the durability of that immunity is less predictable and less stable. While the vaccine has remained safe, we know that a majority of patients only experience minor side effects. We know that it's maintained at least 90% effectiveness in reducing hospitalizations, and that immunity lasts. It's a robust immune response. It's stable up to 6 to 8 months. That's what I wanted to share.
That's
Thank you.
great. Thank you very much. Let's shift over to Mike. So Mike, your work puts you in touch with many DH staff, and there may be many insights you can share about the concerns they have about the vaccines or your experiences just in the lab, sort of writ large.
Yeah, I think the laboratory is like a cross section of the rest of the health system. That 80% of the laboratorians have been vaccinated, but approximately 20% have not. And I think if there's one insight that I could share was there is some confusion around the vaccines and the safety of the vaccines and the need for the vaccines. So I hear that quite a bit. First, let me just say, I understand the reason for the confusion. I mean, it has been a very interesting 18 months. And for the laboratory going back to March, quickly coming up with testing and learning about SARS-CoV-2 as a novel virus. And as we learned and got on that learning curve, many things had to change and change rapidly. So that change, I think, created a lot of concern and a lot of confusion. Although SARS-CoV-2 is a novel virus, and some of the vaccines that we're using are new viruses, although it's all new, we do know a lot about viruses, and viruses, unless their spread is stopped, they're going to continue to mutate and get more virulent. So it's important to stop the spread of the virus. Also, we know a lot about vaccines, and we know vaccines are our best tool to stop the spread. So the vaccination is really the key to battling this pandemic.
Excellent. Thank you for that. And Marilyn, from your position from inside the pharmacy, before we get to the specific questions, do you have anything you want to share from that perspective, from the pharmacy's perspective?
Sure, yeah, I can share the pharmacist perspective. I think some people have hesitancy around the vetting process that the FDA has. While I've never worked for the Public Health Service, I did do a rotation there as a student. And just so everyone is aware, the emergency use authorizations that all three of the vaccines have, they needed to have at least 2 months of data with the phase 3 trials, which is the last phase of trials before a drug hits the market. And the Pfizer approval has at least 2 years of safety data and efficacy data supporting the now approved vaccine. So I think if anybody has other questions about the vetting process in particular, I'd be happy to answer those. But I think we can all trust the Pfizer at least, and definitely the rest of the vaccines approvals from the FDA perspective.
Excellent. Okay. There we go. Okay. So Dr. Mercado, there's a question here from someone who says, I had COVID this year. In February, the BBC reported that France's health authority recommended anyone previously infected with COVID-19 should only receive 1 vaccine instead of the normal 2. What can you tell me about past COVID-19 infection and vaccination? And would Dartmouth-Hitchcock accept this? That might be a question too for Dr. Adamo as well. So we'll start with Dr. Mercado.
That's a very good question. And, I think per CDC's recommendations, individuals previously infected with COVID-19 should still receive vaccination. And there's 2 components to that. One is the durability of immunity from natural infection. Again, right now, we think that it's stable and may last to maybe up to 6 months. So that's a range of 3 to 6 months. as I previously shared, that the immune response to the vaccines is a bit more robust, a bit more predictable. And right now we know that that lasts somewhere between 6 to 8 months. So I think on top, the other aspect on top of the durability of immunity is we've heard about variants, and we've heard that variants can reduce the vaccine effectiveness. And as new variants emerge, we need to make sure that you have that immune response so that you can still prevent hospitalizations and severe disease. And that's really what's evolving, and that's why we need the vaccines, even if you've had been infected with COVID-19.
Great, thank you. Before I shift over to Dr. Adamo, I just want to remind people, put your questions in the Q&A function, and those questions will get to me anonymously, and then I'll make sure the panelists can respond. Did you want to respond to that at all, Dr. Adamo?
I think Dr. Mercado did a great job with explaining why we need to for lasting immunity.
Okay, thank you. Just a question for, I think for Mike. Pathology and laboratory medicine really distinguished itself in the early days of the pandemic, stepping up to help the state in rapid processing of a huge influx of COVID tests, working with researchers on new therapeutics, really a major factor in our response. From your perspective and with your large staff, why is it important to get the vaccine?
Oh, no, our vision is to, keep our population and our state and our region the healthiest as possible. And at the beginning of this pandemic, we were really operating off of that vision, but also working with the state public health lab, being the laboratory, the first in the greater northern New England to offer, first hospital to offer the testing. We were working with a lot of hospitals and doing a lot of testing, not just for the New Hampshire Public Health Lab, but for other hospitals as well as our system. And that was all focused on keeping our community safe and identifying and help with contact tracing and community transmission. But before I even started that testing, I had concern for my own laboratory workers. And we did risk assessments on all of the procedures and the processes and equipment to make sure that the laboratory staff were going to have the equipment they needed and going to operate in a safe manner. We shared those risk assessments with the staff, gave them an opportunity to ask questions and sometimes refine those. At that time, we didn't have the benefit of vaccinations. So we were really relying on the PPE. I really don't see vaccinations any different than that. Vaccinations are going to keep our staff safer. It's going to help our community and our patients to stop the spread. So that's sort of my takeaway. The vaccinations are in line with everything we've done through the beginning of this pandemic.
Thank you, Mike. This is a question that came in on the Q&A, I think from Marilyn. How can we trust the vaccine when there is no data telling us what side effects we may encounter in year 1 or year 2 time?
Good question. Thank you for submitting that. The side effect profile is reported on both the emergency authorizations and the full approval. Fun fact, all of the FDA letters and information is public access. They do redact the copyrighted content, but they have all of the side effects posted on their website. I actually have it pulled up right here. So they list probably after the second dose, which was my experience as well, the normal things of fatigue, headache, muscle pain. Those are things that are a little bit more innocuous in comparison to some of the prescription medications you probably have in your cabinet today. When we think about over-the-counters and herbals and things like that, which may have drug interactions or adverse reactions, this is very innocuous compared to those. And with a day's rest, most people see resolution of that. There is no patterns of data to suggest that there are any severe outcomes, even with the 2 years of data that Pfizer has in their belt. The other thing I'll say is that mRNA is a very unstable molecule. We know that it can't be outside the freezer for a really long time. It can't be exposed to light. So when compared to the force of nature that is your body, you really won't expect to see any response besides what you see in the 2 weeks after you get that dose. So I would expect there will not be additional safety findings because it's going to be excreted from your system pretty quickly after that.
Okay, very helpful. Dr. Adamo, a question in the Q&A that asks, can you talk about ivermectin and vitamin D as preventative measures versus the vaccine?
Thanks for the question. There's not much out on ivermectin in terms of being prophylactic. I know it's been used. I do not believe that it is FDA approved and that would be off-label using. In my career, I don't, and actually, I think Marilyn could probably attest to that. It's not FDA approved for that and therefore off-label. And as a practice, I do not use off-label for anything and for any patient. I don't know if you want to add anything more, Marilyn.
There was a
I
question
believe Sorry.
too, just about the vitamin D part. The person had asked about vitamin D as well and didn't know if that was something they wanted to address separately.
I'm not sure about the vitamin D, but with regards to ivermectin, I did see an email this morning. The AMA is suggesting that all prescribers who are currently considering that as a therapy to stop. As we mentioned, there isn't data to support that. It is used in horses, so now there's a severe shortage for the horses that need it. So I would stick to the human approved therapy for anybody looking for resources. And if we're concerned about that, really the best thing you can do right now is to get the vaccine to prevent any infection. I think the safety is there for us to kind of evaluate and trust, but that would be my suggestion.
Okay, excellent. There's a question that came in about concerns about taking an experimental vaccine and the possible side effects. And we had recently understood that the FDA had approved Pfizer for its full use. So what's the difference? I think this one can go to Dr. Mercado. What's the difference between a full authorization and the experimental authorization? Can you describe that, please?
Yes, so the emergency use authorization really just allows the FDA to approve certain therapeutics in a public health emergency. So as Marilyn had shared, it's not that these companies have cut corners. They've really, it's best available evidence. So the advantage of receiving full FDA approval is that now those companies can market those, and those who may have been hesitant because it was quote unquote an experimental drug or haven't really heard about it, now we can maybe have those individuals who are hesitating to get the vaccine change their mind and consider being vaccinated. I think just in line with other questions regarding safety of the vaccines, it's a risk versus benefit, right? So we've heard about myocarditis in messenger RNA vaccines, and people who get COVID are 16 times more likely to get myocarditis compared to someone who got the vaccine, where there's maybe less than 50 expected cases out of 1 million people who had received the messenger RNA vaccine. So that's like thousands of people who we have prevented being infected. We have prevented being hospitalized and even deaths that we've prevented by doing that. So I think that's one way to kind of weigh the risks and benefits, is that yes, there may be some adverse effects, but there's also really concerning adverse effects if you were to be infected with the virus.
That's a great answer, and one that connects directly to the next question that came in on the Q&A for you, Dr. Mercado. Does the vaccine prevent you from spreading COVID to others?
The one concerning thing with this Delta variant is that individuals who are vaccinated may still be able to transmit the disease, although for a shorter period of time. And I think the other benefit is that individuals who are vaccinated and still get COVID, they have asymptomatic to mild symptoms. Now you ask about, well, what is the benefit of that? If I can still infect others. I think you have to put in perspective where we are in the pandemic. I think where we are right now is we're still trying to control this. We're still trying to reduce hospitalizations. We're still trying to reduce deaths. We don't want to overwhelm the healthcare system. I think that's the first step. Now when we get to the point where there are enough individuals who are immune and we can help stop this spread of the infection, then that's the point then we can decide, well, is the goal to get rid of the virus or allow it to become more of a nuisance? But in the meantime, we really need to focus on getting more people vaccinated so that we see those hospitalizations and deaths decline.
Very helpful. So this is a question for, I think, probably Dr. Adamo. It actually could apply to the whole panel, but I'll throw it out to Dr. Adamo first. This person says, I've had 2 renal transplants and I'm on a few immune suppressant medications. Do you have enough data to say that it's safe getting the vaccine? And please explain what data you have.
Thank you. So I don't have any data in front of me. However, based on scientific articles that I've read and talking with rheumatologists and other docs who are from transplant, is that immunocompromised patients are the very most important patients that should be receiving this vaccine because of their condition. It will save their life because they're already starting out, with a disadvantage. And I don't know if anybody else in the panel would like to add to that.
Maybe Marilyn, did you want to take a stab at it from the pharmacist point of view?
Yes, sure. So we know that the vaccine is efficacious, as we mentioned. The CDC has recently released the fact that we need immunocompromised people to have a 3rd dose as well. That's not because the vaccines are ineffective. It's that the immune system of the person who is immunocompromised might not reach the same level of activity as someone who isn't. And for that reason, as Dr. Adamo said, it is of the utmost important that they are vaccinated. I think the other thing you can consider is for those surrounding that immunocompromised person, it is imperative that they too are vaccinated. Someone important in my life is immunocompromised, and I think about him every day. And so making sure that you keep that in mind when you're weighing the risk versus benefit of making this decision is really important.
Great. So there's one question that I really want to throw out to Mike, because it probably does weigh on him as somebody who works with a lot of people at Dartmouth-Hitchcock, and that is people who are afraid to take the vaccine because of the possible side effects, not just the side effects that they're concerned about long-term, but even just how they feel after taking the vaccine and maybe losing work and so forth. Can you just speak to those concerns that people have about taking the vaccine and what possible side effects they might have immediately and then in the longer term?
Yeah, again, like Jose had said, it's all a risk benefit, right? There are side effects. I mean, when I had the Moderna vaccine, and the next day I didn't feel great. I had a slight fever and some aches and pains. So yes, those side effects though were sort of a nuisance and not very severe at all. But I still thought it was the right thing to do, because your alternative is, if you get COVID, especially in periods of high community transmission, then you're really going to have some sickness and possible hospitalization. So again, it's a trade-off, and I think the benefits of the vaccine far outweigh the risks of a inconvenient side effect.
Thank you. So we are, believe it or not, almost at the close of the half hour. So I want to give each of you a moment to share the one thing that you feel would be really important for people to retain from this and kind of think about. And And before we do that, I do want to just mention to folks, because there are a lot of people on this webinar and some questions that we didn't get to. If there are questions that you want answers to, but we didn't get to today, please go to the HR info line at hitchcock.org and you can put your questions in there. We also may do, because this one was obviously popular, we may do another webinar with the same folks if we can get it in the next couple of days. So we're gonna work on that because it seemed like a half an hour was just not enough time. So with that, I just want to start maybe with Marilyn. And what's the one thing you want people to take away from today's webinar?
Sure. If you trust the modern medicine that we practice here at DH, please trust the science and the experts here and get the vaccine.
Thank you. Jose.
Yes, vaccines remain to be the safest way and the most effective way to beat this virus. You know, COVID-19 is a preventable disease at this point. And if we don't get to that point wherein we're stopping the spread of infection, unfortunately, it does mean that we may continue to see variants and we may continue to follow mitigations, such as mask mandates. So encourage everyone to get vaccinated.
Thanks. Okay, let's shift over to Mike.
Yeah, I would say similar to Marilyn, follow the science and how well this is studied. If you're on the bubble about getting the vaccine, there are a lot of myths out there circulating through social media. That's probably not the best factual information. So if you got questions, seek out your primary care provider or do some reading yourself through the CDC and the FDA websites, speak to some healthcare providers and really follow the science and get your questions answered. And hopefully that will be vaccination.
Great. And it sounds like Phil, you have the last word.
Thank you. As I mentioned earlier, history has proven that vaccines are effective. We've eradicated smallpox, and it is the only virus that has been totally eradicated from the world. The H1N1 did not get to pandemic stages because we quickly had a vaccine to help decrease the spread of the vaccine. So I ask you to, as a public health physician, to look at science. Please realize that one of the best accomplishments of public health are vaccines. Children live longer, adults live longer, and I think we all want to live longer and also be very functional. So thank you for listening.
Thanks everyone for joining us today. We hope you found the session valuable. Please go to HR Infoline at hitchcock.org if you have questions. And thank you so much for today, and take care of yourselves and each other. Bye-bye.